which is we look in the cell therapy, we look at the patient as an individual, as a whole. So not at a certain point, at a certain disease. We don't treat, let's say, a cough or a pneumonia or a breast cancer or a prostate cancer, but we treat a person, an individual whose organism allowed to have that kind of disease. Mm-hmm. So because each individual has his biography, has his a synergy of different things which come together that any kind of disease starts. Mm-hmm. So, and when we are born, we are more or less fit and healthy, more or less. But through environmental stuff, through genetical stuff, to habits we get through our parents or through ourselves, we get along the line a little bit sicker. So we have in the normal school medicine, the university medicine is just looking for symptoms, and without the symptoms, just treating symptoms. Like headaches, you get a pill, headache is gone. But what does it in your body? It can harm your stomach. It can harm your liver. All medications have interactions with each other. And if you have some allergies or any kind of food disturbances, you have a lot of things which interfere with the symptomatic treatment. In the therapy. In the cell therapy, we try to help regenerate the whole body, the whole person, that it can be repaired and can help itself. A big problem in all kind of diseases is you are out of your balance. Like in the Chinese medicine, they always say you have to try to stay in your balance and to get back to your balance. In the cell therapy, we either give cell extracts, stem cells, which can repair, well, they go where the most need is. So they go where they can repeat and where they can look, and they can repair, try to repair, but also we use, as I said in some lectures before, that we definitely need to help the body that he knows where to go. That means priming with any kind of so-called growth factors, which we derive from embryonic and fetal cells. So for repairing of the system, digestive system, liver damages, we can give cell therapy, but in addition we give as priming liver growth factors. Or in neurological diseases, Parkinson's, Alzheimer's, or multiple sclerosis, we give neuronal or brain growth factors. That the cells the cells that should be repaired are more active. So we give the cells and in millions, but our body has billions of cells. So it's actually a small amount which we give the body to try to repair. And after a while, those cells are deteriorating, even the stem cells go down in numbers, and so it's always a lesser amount of cells which can repair. And so the effect will eventually go away, as we know. But if we give in addition those growth factors, we can push. First of all, we can boost the activity of stem cells. We make it even more active and longer active. So because the cells are, it's like a domino. They push your own cells. They can teach your own cells what they should do, what they didn't do, and to keep that up, we give either beforehand or after that those growth factors to push a little bit your own cells. So you can help yourself, and the push is done by the cell therapy, by the cells, and with those growth factors which are part of fetal or embryonic cells of a certain kind of tissue, let's say liver or mesenchyme or whatever, it's pushed so that you have a longer lasting activity, which even the activity for the cells which you give right away are a lot more. So it's a elegant expansion and more sophisticated treatment, not just give cells and say, well, now you can go and watch what happens, but we can direct the therapy to organ systems where we want to have, where we stress the body to repair there faster. And in tumor cells, any kind of tumor therapy, we have the problem that everybody produces tumor cells every day, but a normal immune function, a normal immune system recognizes those cells and is catching it. In a lot of circumstances, whatever reason for, they are not able to cope with those damaged cells, with those tumor cells. And so if we boost, so first of all, that's why a tumor disease can start. And it takes normally years from the beginning of the turning point, of the point of no return, where a cell begins to be tumorous, to actually spread of a cancer. So we have, if we keep up the immune system and repair genes, we activate repair genes, the more we can cut down on tumors. What the normal school medicine, what are they doing? They are just cutting down on numbers. They try to cut down on numbers by operation, by chemotherapy, by radiation. That's a fine thing. But I have already a weakened body, and if I hit them with operation or heavy operations, or with radiation, or with chemo, we even drag that body down. And there is a few years ago was a book, Chemotherapy Heals Cancer, and the World is Flat. That's the same thing, because there is no proof that with any kind of chemo or radiation you can definitely cure a cancer, because that's not the reason. I just cut down on numbers. It's a symptomatic treatment. With the cell therapy, and sometimes we even combine school medicine with our cell therapy treatment, that we, on one side we have the balance. On one side we try to cut down on the cell and the tumor cell numbers. On the other side we try to help the body to repair itself and to get faster to the damaged tumor cells, and to activate natural killer cells to repair the damaged organs. So and that's why our successes are bigger and a lot longer lasting than, besides the quality of life, than the normal